Hello. I'd like to welcome you all to our second Reede Scholars live podcast, Let's Talk Health Equity. I'm Mary Fleming. I'm your host and current president of Reede Scholars. And just for you all who don't know, Reede Scholars is composed of physicians, dentists, mental health specialists committed to collective action to achieve health equity. So if you're listening, I'm assuming that you are aware that there are health equities present in this country and globally. And the purpose of this podcast is not to identify or discuss health disparities in and of themselves, but rather to have conversations with leaders in health equity, highlighting innovative solutions to hopefully work on narrowing the gap. With that being said, let's talk health equity. Today's guest is one of our own, Reede Scholar, Dr. Darrell Gray. He's from the class of 2014. Darrell currently lives and works in Columbus, Ohio with his wife and daughters, but he hails from Baltimore, Maryland, and has trained across the country, including Morehouse in Atlanta, Howard in D.C., Duke in North Carolina, WashU in St. Louis, before coming and completing, the fellowship in Boston. As a gastroenterologist, he currently serves as an assistant professor of medicine, director of community engagement and equity and digestive health, medical director of endoscopy and gastroenterology services at University Hospital East, and deputy director of the Center of Cancer Health Equity at the OSU CCC. Did I get all of that right, Darrell? That's a mouthful.
Yeah, it's a mouthful, and since that bio was sent, some things have changed, such as getting a promotion to associate professor. So that's all good.
That's exciting. Congratulations.
Thank you.
Well, welcome. I appreciate you joining me today. Is there anything else that you want to add or that I missed, or you definitely want to highlight about what we're going to get into some more stuff, of course, as we go, but any big things I missed?
No, thank you for that amazing introduction. I need to bottle that introduction and take it with me when I go different places. And I want to apologize to the listeners in advance if they hear sirens going past. I'm in my office currently, and sometimes you may hear sirens going beyond. So I want to apologize to the listeners for some background noise.
That's quite all right. This is real life, and the work has to be done. So it's I think they'll forgive us for that one. So kind of diving in, I know so clearly, from just from the brief bio that we mentioned, you are heavily engaged in health equity space now. But before we got really into what you're doing now, can you tell me a little bit about how you initially got interested in health equity in general and what led you to gastroenterology, just to kind of, give us a backdrop for our conversation for today.
So as I think about kind of influences into my current roles and really getting engaged in the work of trying to push others and health systems and people towards embracing health equity as a goal, I think back to kind of my parents. And I was fortunate enough to grow up in a two-parent household where my mother was a teacher. She taught in Baltimore public schools and Baltimore County public schools for over 30 years, and she did some work in special education and multiple other facets of education. And my dad practiced medicine, actually internal medicine in inner city Baltimore. And so I got to see at a very early age kind of the impact of social determinants of health as well as healthcare on people's well-being and health. And certainly as that kind of was further cultivated with love of sciences through education at Morehouse College and later through exposure to medicine at Howard University College of Medicine, really that love grew more. And I began to think of ways that as I saw myself as a specialist in medicine, I could incorporate this vision for health equity into specialty medicine. And initially I thought that would be through cardiology. So in medical school, I was an aspiring cardiologist and thinking that I would be addressing cardiovascular disease, which is the number one killer. And as I went to my residency in internal medicine at Duke University and had exposure to cardiology very early, I recognized that I liked it, but I didn't love it. And I was fortunate to have mentors, both women and men physicians, who were gastroenterologists, and I got the opportunity to shadow in clinic and see them do procedures and saw how they were able to have impact in their particular niches, but also I could envision an opportunity for me in establishing my own niche to have impact on underserved communities. And for me, that kind of materialized in work around colorectal cancer prevention, which is the second leading cause of cancer-related death and disproportionately impacts people who are impoverished and people who are of low socioeconomic status and people who are Black, particularly, have the highest incidence and mortality rates from colorectal cancer. And so that's really kind of the beginnings of my foray into this work.
Makes a lot of sense. It makes a lot of sense. I think, um, for most of us, there's some spark or something that, or a series of events, most likely, that led us down the health equity
Yeah.
path. And I think once kind of know what things are going on, that you really feel like that, we have you know, a, um, an obligation to try to help in some capacity. And so, I mean, you clearly do a lot. And you spoke a little bit about your passion around colorectal cancer prevention screening, and you mentioned some statistics. But just to make sure everybody's on the same page, is there um, anything else we need to know, specifically around um, statistics or anything specific to Columbus or Ohio that you would like to highlight?
Yeah. I mean, I think as we think about addressing health disparities and moving closer towards health equity, we always have to be thinking about, obviously, you identify the problems, right? But you want to identify action steps and then take that action. And I think, one of the things is we try to um, move closer towards health equity. We also have to understand, well, who are the players and who's engaged in this work? And unfortunately, the landscape, particularly if we look at healthcare delivery, those engaged in healthcare delivery, those in medicine and allied health professions, et cetera, public health, the face of that does not reflect the face of America. And particularly if we look at African Americans and even more specific African American males, we're not seeing kind of a mirror of the population reflected by those faces. So, whereas the United States is approximately 12% African American, usually less than 5% of those in medicine are African American. And when we talk about particularly Black men in medicine, so, well, African Americans comprise about 4% of the physician workforce, but Black males comprise closer to 2%, and 2% certainly of full-time faculty at MD granting institutions. And this has significant implications. There are less, a 2015 report from the AAMC called Altering the Course demonstrated that there are less Black men matriculating through medical school than in 1978. I mean, that's crazy.
That blows
Our
my mind.
sisters, our sisters, our Black sisters are excelling and they're doing great, and we will continue to champion them doing great along with our Latinx brothers and sisters, increasing numbers. But we are not seeing that amongst Black men in medicine. And certainly, we're also not seeing that amongst our Native American brothers and sisters as well. But so that's a problem, and it's a problem for a couple of reasons. One, it impacts training, right? So if I'm in medical school and I look to my left and I look to my right and I see everybody that looks exactly like me, I'm not getting exposed to different cultures or backgrounds that may make me more effective as someone in patient care and directly interacting with patients and communities from diverse areas. Two, there is ample data that suggests that diversity drives excellence, diversity impacts patient outcomes and care, and even specifically at the granular level that having some patient-physician concordance impacts whether people will adhere to recommendations that are being given. Now, that's not to say that every patient should try to find a doctor that looks
Right, right.
exactly like them. skin color, that is. That's not what I'm trying to say. But what I'm trying to say is that there is importance in having diversity, and Black men are in a critical part of that diversity. And so we need to do more work to enhance the diversity of our physician workforce, and particularly enhancing the pipeline of Black men going into medicine.
Yeah, and that's definitely something I wanted to spend some time talking about today because I think, uh, in having these conversations about diversity in the classroom and really trying to help people understand that it doesn't start when the physician walks into the room, right? All of these conversations need to be had as part of the educational process, probably before we even get to medical school, right? And so that we're comfortable having conversations in diverse spaces, and even when we are interacting with people who may not be like us, be sensitive that they may not be like us and understand how to negotiate those cultural
Right.
dynamics in a sensitive way. But also making sure that it doesn't impact their care in a negative way, right? And so, I know that at least the conversation is happening a little bit more, and I see you and some of your colleagues, speaking a lot about this, not just in the academic space, but you clearly have, gone further beyond that. You've got YouTube videos online. I know you've been on TV and radio, trying to make sure that everybody's engaged in conversation and how important it is and how we need to keep, not just talking about it, but exploring solutions that we can help recruit. And I don't even know if recruit is the right word, but just help young Black men be interested in medicine and knowing that making the diverse space will make us all better, right? Clinicians, all better academicians, and that type of thing. So one of my questions was going to be, when you're moving that conversation forward, when you're trying to make people understand why this is important. What have been your biggest rewards, or what are your biggest
Absolutely.
struggles, even with having conversations with people who may not necessarily understand, why there are those of us who thinks this is very important.
Yeah, I think, one of the challenges is trying to get people who have not traditionally been invested in such a conversation, or who have difficulty empathizing with the importance of, for example, diversity in medicine, to one, come to the table around this, but to two, put, resources behind changing the paradigm. And so I think that in itself has been a challenge, but not one that's not overcomable. I and so one of the rewards on the flip side of that is, I think, as much as I and others at Ohio State, but also across the nation, who've partnered around this issue, one issue being obviously Black men in medicine, but is seeing, going into spaces and thinking that you need to be the one to champion it, but you start hearing your words and the words of your colleagues being echoed. And so, to see that what you've done, as an individual or as a group, being kind of championed by others, that's a huge reward. And whether it be people who are students to people who are fellow faculty or in leadership, in different sectors. So not just academia, but in other sectors, kind of championing that work is extremely important. And that translates similarly to, as we talk about how health systems address social determinants of health or non-medical social needs. It translates to, what's happening, what health systems can do literally at the community level, all the way up to the policy level, and being active in decision making that happens at a structural policy level, to change healthcare for vulnerable populations. And so that's tremendously rewarding.
That makes a lot of sense, and I think um, when you're talking about changing the paradigm, right? So medicine as a whole, the culture of medicine can sometimes be a little slow to change, right? From everything that we do, and I think just the movement will be slow, but it will come. And I think that was interesting when you said when once you hear other people saying what you say, you know that the conversation is continuing without it. And I think especially for a lot of us who are really heavy in the health equity space, and when we talk about um, we used to use words like critical mass and that type of thing. But when we're in healthcare systems and we're in this space and we're the only
Hmm.
one who finds this, not necessarily finds it important, but is willing to put it on the table, put it on the agenda, and push the conversation, it can be hard to be that only one. But when you can get a few allies, you can get a few people who understand that,
Yeah.
that it will make everyone better. It will make your whole health system better when we address these issues. Then, like you said, then other people will pick it up, and you
Yeah.
won't feel like so much pressure to carry the conversation.
Yeah,
So,
and I think too, one of the things that, like you said, we've been at this for a little while now, and so what's been exciting though is to see kind of health systems really seemingly investing more in this work, and certainly, um, albeit you would like to think it's all altruistic, it's not,
right.
but it still allows the work to get done. So it really is exciting to look across the national landscape and seeing health systems, and private sector organizations, um, investing in this work.
Definitely. And I think um, I think there's reasons to be optimistic, right? So, a lot of times this can be discouraging, right? Because it does move slow, or
Hmm.
people don't necessarily quote unquote get it. But I think we're in a nice place now that it seems to be more important. And like you said, some because people get it, and also some because it increases improves your bottom line, right? If your people are healthier, you're gonna your profit margin
Hmm.
is probably going to change. So we get that. So kind of
Hmm.
looking forward in this optimistic lens, are there anything or any things I should say that you feel particularly excited about that you see on the horizon? Are there any exciting, when we think about education and uh, increasing diversity? Are there any exciting pipeline programs that you want to share with us,
Hmm.
or any new funding opportunities, or, do you think the innovations are more in training
Yeah.
once we get to the undergraduate or graduate, or even, postgraduate training? So just wanted to give you some, a little
Yeah.
bit of time to talk about, what do you see on the horizon and what people should be looking for and talking about.
Yeah, I think this is such an area that is ripe for, improving, as we talk about the pipeline. One exciting thing that I'm engaged in here in Columbus, but I've seen models elsewhere outside of Ohio, is health science academies. So we locally have health science academies that spans from elementary to high school, particularly in this, network of 7 schools that traditionally was underperforming. And really, Ohio State, partnered with the Columbus City School Districts on this. And really, what that allows is or what it has facilitated is having physicians, nurses, allied health professionals, veterinarians, pharmacists, etc., in the classroom with the teachers and students and helping to deliver the curriculum. Now, the goal is not that everyone be a physician,
Right.
everyone be a nurse, everyone be a pharmacist, but that you be a high performing and ultimately great citizen of Columbus and Ohio. And so this opens the gate for opportunities, and it certainly, hopefully, exposes kids, children, and learners to, as we've been talking about the physician workforce, talk to medicine and opportunities they can have. And there's an old adage: if you can see it, you can be it. And
Mhm.
for many of our children in the inner cities, particularly here in Columbus, Ohio, many of them have not seen a black doctor. I recall, and I give a brief story. I recall going to one of the elementary schools to talk with the principal about Health Science Academy's work and about how we can engage with them. And at the time, we met in the cafeteria, meeting with one of the education coordinators as well. and a student was brought to the cafeteria, particularly to meet with the principal because he required some disciplinary action in regards to something. And the first thing she did was she greeted him just very nicely, and it was a young boy. I believe he might have been in like third grade, but don't quote me. And the first question she asked him was, "Have you ever met a black doctor?" And the boy said no. Said, well, what do you want to do when when you're older, when you grow up? He said, be a doctor. And she said, well, look, I want to introduce you to Dr. Gray. And that was just a powerful moment. And so having such academies like health science academies replicated, across the nation may be a very impactful thing. I think too about kind of moving further up the pipeline, even to undergraduates and medical students, it's important to, cultivate that interest for those who are interested in pre-medicine or medicine, and then help them to overcome barriers that they'll experience in the journey. And so, for example, at Ohio State, Dr. Quinn Capers, even before I started on faculty here a little over 5 years ago, started an African American male mentoring roundtable. And initially, it was for medical students, residents, and fellows and faculty, but it has since expanded to include undergraduates. And it's amazing to see the growth in time, and to be there 5 years ago when I had first started, and to see several people in a room, to now seeing a full room of folks who are either in medicine currently or wanting to get into medicine is really powerful. And so it 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 really underscores the importance of mentorship through this, and exposure to those who've been there, done that, had the same experiences, hurdles, had the same setbacks, and overcome them, to really kind of inspire but provide support to those in the field. So that's another way I think we can continue to grow the pipeline. But even moving further upstream, it's exciting to see national organizations embracing this. So, Ohio State was one of 9 institutions to be part of the ACGME collaborative to address healthcare disparities. And, I'm one of the leaders within this, and it's been fun to really engage our residents and fellows and faculty in the work. I say the work almost in quotation marks to describe, what we do to try to improve health for all patients, but certainly really trying to push us towards health equity, which means we need to do some things for our vulnerable populations who are underserved to get them to the point where they may be close to being receiving fair and just care to or ability to lead healthier lives. And so that's fun. I've been also part of an effort by a national society, American College of Gastroenterology, where we launched a campaign back in April called Diversity in GI, hashtag Diversity in GI on social media channels and social media platforms. And, it has been amazing, not only to see those who have embraced it within our own society, but to see people across the U.S., institutions in Europe and the Middle East jump on board with this campaign and really champion it. Then to see other societies say, hey, we want a piece of this too. And so we're partnering with Pediatric Gastroenterology Society. And there are other societies who I've talked with who are literally calling and emailing me to say, how can we be a part of the solution and making our workforce more diverse? That's exciting. And that shows that the work is happening, being done, being accomplished, and being embraced. So I think there's tremendous opportunity. I've really just talked about some of the things that have happened within my spaces in Columbus, within Ohio, within gastroenterology, but certainly there are, and within the ACGME space or graduate medical education space, but certainly there are things happening across the nation that you've been involved with, Dr. Fleming, and that are happening outside of that really is exciting.
Definitely. I mean, we could spend, I think, another couple hours just talking about some of the things you just touched on today.
Right.
But I mean, I think it's important too that to kind of bring those two things back together. We still have to do the work on both ends, right? So we have to continue to work on making these systematic changes, not just in medical education and medical culture and how the health systems approach health equity and their programs and, reaching out to community. But at the same time, we still have people who are not interacting with the health system in an effective way. And so we still have to go out there and make sure people are getting the screenings right. We still have to make sure people are going to the doctor. Still have to make sure people are understanding their results and doing the follow up. So I appreciate that you talked about all of those facets of addressing health equity, and we can't do them individually. And to me, I feel like one of the things that I'm impressed. I mean, I'm impressed by you overall. I think you're doing great stuff. I mean, I really do. But
Right.
I appreciate that you're coming at it from all directions. And I think I think there are those of us who need to stay in different lanes because, like I said, the work has to be done in each lane. But we also need those who are great at bridging the conversation gap that are just as well versed in the exam room as they are in social media spaces as we are going and sitting in the boardroom. So I really appreciate that about you and the work that you're doing, and hope that you will continue to do that. And I know that you will.
Oh, you know it.
So, with that being said, I'll give you an opportunity for any parting words, any advice, or anything that any call to action that you would like to send out for our colleagues moving forward.
Yeah, I just encourage listeners and our colleagues to think outside the box, particularly, as you have matriculated through training in medicine and are used to wearing the white coat in different spaces. I encourage you to take the white coat off, put your boots on, get out into the community to think outside of just the clinical realm, or if you're in basic science or translational or clinical research, think outside of the walls of the laboratory. Think about ways that you can impact, your communities beyond just that kind of discipline that you've been trained in. And certainly you have support with colleagues around you, me, Dr. Fleming, and others around the nation, the Reede Scholars community, in your work to do it. But we have to think about, if we're going to impact communities, we have to think about, like I mentioned before, social determinants of health that impact, or non-medical social needs that impact people's well-being. We have to think about what we can do from the point of educational pipeline to impacting health. And we have to think about how we can engage others, whether they be policy decision makers, whether they be influencers in other spaces such as social media, whether it be leadership at healthcare institutions around this issue, and continue to push it forward. Lastly, I encourage you to check out, if you're on Twitter, check out hashtag Black Men in Medicine, check out hashtag Diversity in GI. Help us to continue to push these issues to the forefront. And Mary, Dr. Fleming, thank you so much for having me. I so very much admire you and your work. I appreciate how you've been leading the Reede Scholars for so long, and I appreciate this opportunity.
Thank you so much. Thank you so much, Darrell. I appreciate that. Well, with that, I will again thank Dr. Darrell Gray for joining us today. And then we'll include the hashtags on our podcast description so that you all will have those. And I tell you all to be on the lookout. So there are many more great things to come from Dr. Gray. So, thank you for listening, and we'll talk again soon. Bye. Thank you for listening to Reede Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.